All right, now a section of health unions are tonight condemning what they describe as continued violent attacks meted out to healthcare workers during protests in the country. Led by the Kenya Medical Practitioners, Pharmacists and Dentists Union Secretary General Dr.Davji Atellah, the unions now say medical workers have become targets in the very protests where they have long been lifesavers. The healthcare workers now threaten to withdraw their services during protests.
They have always been there amidst the clouds of tear gas, in the chaos and bloodied streets, patching up wounds and reviving the unconscious. Medical workers have always been at the forefront during the protest, and not as combatants, but as caregivers. However, the health unions, led by KMPDU's Secretary General Dr. Davji Atellah, have now raised a red flag over what they say is escalating cases of violent attacks meted out to healthcare workers by alleged police officers and hired goons.
A good number of them are traumatized. Some have actually fallen victim to this culture of violence, mostly meted by police and the goons. And even those who are in the facilities, they are also traumatized by the things that we are seeing.
KMPDU has also decried an alarming trend where medics in their ongoing strike in various parts of the country have now become victims of the targeted attacks.
The goonism that has come up in a very strong way, we have witnessed in our demonstration in Kakamega when the doctors were attacked by the goons. Yesterday, the doctors who were moving or protesting in Kwale were also attacked by the goons. This is a clear indication that there are chaos. And whenever chaos are there, we cannot expect ourselves in any way that we can prosper.
The unions have also noted that public hospitals are now at a breaking point, a looming crisis stemming from the growing number of protest-related casualties.
From the records of the hospitals are already indicating being overwhelmed after every protest. Last week, after the protest, there were so many victims that were admitted in public facilities. There are so many injuries that otherwise can be prevented if we have a situation that there is restraint. The restraint from the police, the restraints and the removal of these goons from the streets so that peaceful protests can actually be peaceful, to ensure that ideally we do not have victims or we do not have casualties that otherwise would be prevented.
To avert the devastating aftermath of this protest, the healthcare workers are now appealing to the country's top leadership to steer a national dialogue to curb the crisis.
Basically to ask for an introspection as a country and as a people. We have been observing what has been happening, and especially the culture of violence that we are seeing against the health workers.
Sisi hatutaruhusu wahudumu wa afya kwenda kazini kama watakuwa wanaibiwa wakiwa njiani wanaenda kufanya kazi, ama hawakitoka kazini wakienda nyumbani kwao.
John Kahiro, Easy Friday.
Viva unions, viva!
Viva!